answered. So let's go ahead and get started with our webinar on our solution for CMS interoperability. I am going to start off by providing a quick introduction to ZeOmega, the corporation. We have been in business since 2001. As you can see here, we first began organic growth at that time and development that really started to kick in about 10 years later, when in 2011 we signed up a number of large regional payers as our initial customer base. These clients saw our technology vision and automation as potentially a key differentiator for them in their markets. And, you know, they must have been right, because almost all of them are still with us as clients today. Fast forward then to 2015, when we acquired an HIE company, which greatly increased our ability to interact with clinical systems and bring those data into Jiva, and Jiva being our main platform name. The people and tools that have been available to ZeOmega via this HIE acquisition has allowed us to participate in the HIMSS Interoperability Showcase and to leverage hospital ADT feeds to initiate transitions of care solutions for our clients. This aspect of our growth also led us toward becoming a founding member of the DaVinci Project, which I'll discuss in a few minutes and probably throughout this presentation. It is the work we have done with this group that has allowed us to use the standards agreed upon by clinical solutions and health plans to easily transition to supporting the 3 APIs that health plans will soon require as a federal mandate as part of our overall platform. Next slide. At a base level, the patient access, provider directory, and even the payer-to-payer data exchange APIs strive to create more and easier data exchange between payers, providers, and members. This is what makes FHIR so important, because these transactions natively enable a very standard approach for data exchange, which with each element really defined with less room for interpretation, as typical HL7, for instance, usually requires a highly technical and business-oriented person to map those data. Here we have true plug and play, and support for these federally mandated APIs in this fashion will help to ensure that as each solution and entity becomes certified on these transactions, they will know that they can connect without much expertise with other solutions that are also certified. ZeOmega has been crossing that divide between payers and providers for a number of years now, so we are not new to this, and we believe that we have a unique, actionable approach that takes these solutions beyond simply being something that you're doing to check a compliance box and implementing an IT solution, because we have the experience with using this data to help manage members toward higher care quality and lower costs. Next slide. This next slide just allows me to briefly again talk about our involvement with the DaVinci Project. Again, ZeOmega is a founding member of this group. It's been around now for about 3 years. It now has over 45 members, ranging from provider organizations, EHR vendors, payers, IT vendors, and a new deployment category of members. The DaVinci Project is charged with identifying and prioritizing key use cases in the data exchange between providers, payers, and members. They also help to lead and develop implementation guides based on FHIR protocols, and of course, ZeOmega has been involved in that as well. Next slide. Here are some of the primary groupings of the DaVinci Project focus. We have developed a number of these various transactions at ZeOmega, not just the ones highlighted, but the ones circled do pertain most to the discussion today and depicts how our DaVinci involvement maps to the CMS requirements, with member access and payer connectivity, of course, taking front and center there. As a founding member, we have participated in various discussions and work groups that helped to develop implementation guides that we were able to demonstrate and test with other DaVinci members, again at the HIMSS and other sponsored connect-a-thons. As we move forward with this discussion and demonstration, we think that you will see that our history and experience with delivering on the promise of payer-provider connectivity and member access makes ZeOmega a great partner as you move forward in meeting these important requirements, and in a way that allows you to add functionality and desired capability to your teams, not simply implementing an IT project so that you can say that you've met a mandate. So with that, I'd like to hand the discussion off to our Chief Medical Officer, Rahul Singhal, to provide an overview of the CMS interoperability requirements. Rahul?
Thanks, Matt, for that introduction. And so I just got a couple slides and wanted to talk about, hey, why is ZeOmega getting involved in CMS interoperability? And as we, had discussed, it's core to our value proposition of connecting payers, providers, and members. And as part of our population health management platform, we've had over 20 years of care management expertise, with data management being a core competency. So being able to manage and manipulate data, it's something that we do every day. And as we're talking with our customers and they were asking us, hey, what are we doing for CMS interoperability? And as we looked at the standards about 6 to 9 months ago, we thought, oh, wow, well, this is exactly where the market's going. This is the work that we've been doing, as evidenced by DaVinci, as building out the FHIR platform, as building out use cases. And since we have quite a few Medicare and Medicaid members, we have a strong compliance team that proactively keeps ahead of the government regulations. And I think our central thesis is, we were very excited when we saw the CMS interoperability standards, and we think it'll drive your population health management. Obviously, for our customers, that would be ours. But even if you have your own, in a separate population health management platform, working with us to help on your CMS interoperability, there's probably a lot of connectivities that we can do because of open API standards, of being able to facilitate communication between provider systems, potentially, obviously, the member, and with the core payer organizations. And so this is a high level of the 6 major requirements for the CMS API regulations. Patient access, I'm not going to go through and read through all of this, but patients being able, I kind of think of this as an electronic EOB, and patients being able to understand and manage their claims and their health. The provider directory, we've got set standards that we do with our customers. So that's, out of the box, we have that built in. ADTs, and that's obviously more between the health plan and the providers to get that data. It is core to what we do with our utilization management modules of getting timely notifications. And so although we wouldn't be primary here to help drive and facilitate some of the connections between your UM system as well as potentially even your CMDM on discharge, that's another area that we can do. Payer-to-payer data exchange, that's built into our system that we've designed for the CMS interoperability standards. And then the other two, we just are peripherally involved. I will say on the digital contact information, we are doing more with consumerism, member engagement. So that is an area of active research and development within ZeOmega. And we're, again, excited to see that CMS is taking a proactive approach.
All right, hey guys, so this is Tony Shang. I'm going to take over in terms of walking you guys through our solution. I lead our interoperability solutions here at ZeOmega, and just thank you so much for joining the session as we give this walkthrough. So there's a lot on this slide. It's a busy slide, a lot of complexity. All I will say here is that we understand the various requirements and the guidelines that CMS provides. We understand the data sets, we understand and have already built out the various frameworks and have in many cases tested them with other parties as well through various connectathons that we've been participating over the past couple of years. And we also understand that you guys have a deadline and we're here to help accelerate the process and make it as easy as possible. This is not a brand new solution for us. We didn't start building this out when the rule dropped in March. This is something that is the combination of at least a couple of years worth of investment specifically around this information. CMS was part of DaVinci, and through our work there, we're able to leverage that work towards meeting these requirements now. So this slide shows the various building blocks for the solution, all the components that you would need, and it includes aspects that are not even necessarily technical, although we are providing a product to obviously support those capabilities. The first step before we even necessarily deploy anything is every payer needs to go through some type of business readiness assessment, need to look at their data, look at where everything's coming from. There's various environments that have siloed data, things being aggregated into an enterprise data warehouse, multiple versions of data sets due to legacy systems. All that needs to be captured as part of the data staging process. And this is something that we recognize some payers are currently in the process of doing themselves. And at the same time, this is something where we've had others that we're speaking to say, hey, let's do this exercise together. And we're here to support that even before we roll out the actual technical components. We support a variety of deployment models. We do cloud, hosted, on-premises. Everybody's a little different, have different needs, and we're here to deploy in the manner which is most appropriate for your needs. As far as the FHIR APIs are concerned, we certainly check all the boxes. We have their server, we have a client, we have the API libraries and the API manager out of the box ready to go. We got reporting dashboards, the various auditing capabilities, and we even have a member access portal. We recognize that you may have your own portal you currently use that you want to integrate with. You also, there will be many, many apps out there when this is all said and done that will also be able to connect in. And we're fully capable of supporting all of those in addition to our own member portal. The EMPI, that stands for Enterprise Master Patient Index. In some cases, our clients or payers will want some type of identity management solution because they don't have a single unique ID, in which case we will employ our solution, which has proven itself in the HIE space for using demographics to match records. And also in other cases where there's not needed because you already have a single ID, a unique ID across the org, then this is an optional module. So moving down to the bottom left-hand corner, data sources and mapping, we recognize that this is going to be a significant effort, and we're going to bring to bear our full claims and clinical data experience. We are familiar with the various exchange formats over the years. We have existing feeds from other systems coming in and also being exported out of our current platform. And we have the tools to map your data to these FHIR APIs. There's various models out there. There's the concept of a monolithic data source where everything's put into one place and we just map to that. We can do this. There's other models where you have individual source systems that you want us to map these different APIs to. Again, it sounds like it's 3 APIs, but it's really about 28 or 30 so APIs. Within that, it's a logical construct, and we can map each of those APIs to the specific data sources as needed. There's also the ability for us to take an extract. So if you send us the data, and we can even help perform the extract, and as part of the process, we're doing the data mapping, and it will take in your data and put it into a data store and make it available through this API. Moving on to the use cases, certainly we support the ones that you need immediately before you for next year, patient access provider directory, and in 2022, the payer-to-payer. But we're also looking ahead. We recognize that this is only the beginning. CMS has made it very clear that interoperability is going to be a long road with potentially no end, and they're going to keep on iterating. And this is really just the first step. And so we see many, many other use cases that this platform will be leveraged in technologies, including Smart on FHIR, which we've already gone ahead and done some of the work to test connecting with providers. So we're already thinking ahead. And so if you partner with us, you have somebody for the long run. And then last, but certainly not least, security and privacy. OAuth 2.0, OpenID Connect. We've implemented these. We've connected with other parties, validated it. Things like consent management, vendor management, these are entire webinars in itself. We have consent experience spanning over a decade from the provider space around HIE implementations, and now we bring that expertise over to the payer space. We recognize with the latest guidelines that there's going to be a requirement to, first of all, opt in or opt out for allowing an app or service to access that member's data from the plan. But also there's going to be additional considerations around sensitive data types, things like 42 CFR Part 2, and doing additional filtering and second level consent. There's discussions around how to implement healthcare proxies. If I'm the parent of a minor, how can I get access to their data and provide consent on their behalf, and how that's managed, and how we will tie that logic to your existing implementations for this within your systems. That's all part of our planning for the rollout of this solution. Vendor management, there's going to be a whole trust framework that's being developed, various technologies that the industry is rallying behind. A lot of these things are not necessarily easily accessible, but because of our involvement, close involvement in ongoing discussions, work groups, following week to week guidance, we're right there at the forefront, ensuring that you have the latest information on how these need to be defined and implemented. Here's a quick slide that just talks about our considerations for and guidelines for privacy, security, and quality. A lot of these may look familiar to you. Obviously, information blocking, security tags, care and code of conduct. There's various API tool sets. There's the internal tool set, which CMS has specified. It's or I should say ONC, and then API testing scripts, touchstone scripts that are used throughout the DaVinci use cases. And we've been using those for a while now to test all of our use cases. And of course, we have our internal automation test suite for all our products, not just this product, which we put our development work through. Here's a quick glance at a reporting dashboard. I recognize it might be a little small to see some of the widgets. This is fairly standard. Things like usage, latency, user subscriptions, where they're coming in from, any throttling that's going on. You can go into our dashboard. You can also go into your own existing BI tool, could be Power BI, Tableau, other, and we can plug into all of that as well. So this slide is really around the architecture. I won't, again, go into all the details here. This could be its own separate discussion. What you really want to take away from here is that from the left going to the right, you have the member accessing through either an app or a portal. We included EMR there because we believe that this is going to be a near to medium term use case as well, where the consent is going to start applying for provider access. But in any case, once they come in, there's going to be a number of things that happen. There's an attestation from the app. That app needs to be trusted and having gone through a bunch of testing in advance and added to a trust bundle. We need to recognize and trust the app in order to allow data to flow. We need to receive the member's consent information and log that within our gateway. And then, of course, they need to authenticate against your existing system, make sure that they're a valid user. So there's a lot of things that are taking place before the gateway will allow any data to flow out. And then once it's, in order to facilitate that flow, we have all those profiles that I mentioned earlier around clinical data, claims data, formulary, and provider directory. And we have the profiles, we have the terminology server, the data set mappings. And on the far right side, we're just giving some examples of how various data sources may be set up. There could be enterprise data warehouses, claim systems, could be even our Jiva system if you're one of our existing clients. And we can map to that data either through extracts or through direct API connections. Here's a slide. I recognize the font is probably too small to read, but the purpose is to show that because we already have a platform that contains clinical and claims data that payers are using, we've gone ahead and mapped that data to our own platform so that available out of the box, it will just be plug and play. And in addition to this out of the box native integration, our tools, of course, are there to accelerate integration with additional data sources. So with that, I'm going to pass over to sharing my screen over to my colleague, Pavan, our solution architect. We really wanted to be able to show a demo of this somehow. Interoperability is always hard to show. It's easy to diagram things out, but in order to show it, it's all plumbing for the most part. And so this is what we come up with. We've taken our member portal, and what you're seeing is the dashboard that was prior to the CMS rule. Members are able to log in and see the information out of our system using our existing APIs. But we've gone ahead and implemented a special instance in our innovation environment where we've added some tabs to the left-hand side. So for example, if we click on patient access, that will show the clinical data set. And this is not user-friendly. This is not intended for a member to consume. This is purely a tech demo. I just want to put that qualifier out there. What we've done is we've taken the various FHIR profiles, the US core profiles specified under US CDI, for the patient access API. And we've done, so this is a FHIR client essentially, and this is connecting to our FHIR server on the backend, which is connected to our data store. And if you click on one of these FHIR resource buttons, what it does is it actually pulls up a new window that shows you the sort of the techie JSON response from our server. And this is real, this is up and running. And you can do that for any of these resources. So for clinical data, that's that. Blue button, this, we've actually implemented a connection out to the CMS gateway because they actually have implemented a consent, an existing consent framework. The one that we need for CMS compliance under this rule will be a variation of that, but we just wanted to show that we understand how this works. We understand that there will be some type of attestation, some type of consent being given by the member. They need to allow access, and then only once they grant access, then the source system will allow this claims information to flow through. And this is something that would apply across our gateway. We need to log the consent before any app can have access to the information. And then you can click on the next one, plan coverage. This is the formulary information that falls under patient access API. We've gone ahead and plugged into the DaVinci sandbox where they have sample data for this. And of course, all the test scripts I mentioned earlier. And we would map this to your formulary information. Similarly for provider directory, many of you already have a provider directory of some sort. It's in a database somewhere. Maybe your members can go to a website and do a search for providers. CMS wants this information pulled in through this same member experience, through this member app or portal. And again, here we've implemented it. The data source that the data you're seeing here is pulled out of the DaVinci sandbox as well. And we would map to your provider directory wherever it is, or you can send us feeds from your provider directory, and then we will similarly display the information to the member and make it searchable. Okay, thanks, Pavan. So with that, we'll pop back over to the presentation.
Hey, Tony, this is Matt. There are a couple of questions out there. I don't know if you want to take a second to answer before you get back into the one.
Absolutely.
Do you provide support in testing vendor applications for the patient access API? Can ZeOmega provide a testing environment for payer clients?
That's a great question, and we absolutely do that. We will have a developer portal available for those that we work with, and in fact, we already do this as part of Connectathons for our partners that are developing this. Other apps, third-party apps, want to test against us. We can do this near real time, and they can submit requests into your environment. So absolutely, if we're working with you, you will have an environment that we will spin up specifically for you to go in. It's called, it's our sandbox environment for development. In fact, we have, I believe, sandbox, then dev, and then UAT, and finally production.
Great. And this is a two-parter. And Pavan, you might want to tee yourself up here to help with this answer. The two-parter is, what FHIR server implementation are you using? Are you using Happy HAPI or Smile or self-developed? Also, FHIR facade or repository model for us?
Sure, Matt. I will take the first.
Mm-hmm.
Yeah, go ahead, Tony.
I can answer at a high level those questions just because they're very common questions. But if there's any more specific questions, we can certainly take them that are more technical in detail. So obviously, we're very familiar with Happy and Smile CDR. They're one of the platforms out there. We made a decision to not use that. We have our own solution, but it's built off Python libraries and it's built off existing open source libraries. So we didn't build it from scratch. It has very similar capabilities to what Happy provides. I believe Happy is based in Java. And so you can think of it as a Happy equivalent, and then I think the second question was facade versus repository. And I'm sorry if I wasn't more clear earlier about this. We do both. So from a facade model, it would be us connecting to a data source and just leveraging our APIs. We might have a repository just for Fire extensions, but for the most part, we're not creating a second copy of your data. And then the second model is repository, where you're actually sending us a copy or extracts of your data. And in this case, we would build the extracts as well. Of course, that's part of the data mapping. And then we have our own data store, which will then serve up this information on demand when a member comes in.
Great. That's it for the questions. Thanks.
Great. Thank you for asking. And any other questions that comes along, please, I just post them up and we'll answer them at the next logical break. So I will forward some of these screenshots for the demos. We're just using sort of our overview deck, and in many cases, we don't have time to do a actual real-time demo, so that's what screenshots are for. So implementation steps, we'll try our best to sort of outline what that looks like. Obviously, again, we're here to tailor this to your needs and meet you where you're at. For some clients are really far advanced in terms of just doing analysis. I've recently spoken to one that is doing a 3-month process internally and working with folks to kind of level set where they are at before they're even engaging the vendor partner. And in other cases, we're with them at the ground level. When they're talking to us, they're saying, help, we need to do this. Just tell us what the requirements are and tell us what we don't know. And we're happy to support you in both of those scenarios and everything in between. So the readiness assessment, the data staging, helping you determine what the most appropriate deployment methodology is. And again, we're not building something when we come. We're coming to you with as much built out of the box as possible, and then we are using those tools to connect up the rest. And we have reference implementation guides and mappings ready to go. The data mapping, we have data mappers to do this. We have for relational databases, for ETL extracts in the case of the repository model coming in. We have various configurable tools, again, leveraging our HI experience where we have massive amounts of data flowing in from many, many different source systems. We have ways to quickly adapt and map that information as it comes in and iterate quickly so that we can build these mappings with minimal overhead. Security and privacy. So authentication and authorization, of course, the member needs to authenticate. There needs to be basic security requirements in place. But in addition to just those technical safeguards, there is a third-party attestation and validation process and framework. We're working with various industry bodies and partnering with them in their beta programs as this is being developed. So again, we're not even waiting for things to drop. We're right there providing feedback and working through to develop this framework. And then member consent management, again, we have the HI experience. We understand how Blue Button has implemented consent, and we understand sort of the unique challenges with this particular requirement and how that needs to be adapted. Certification, there's going to be various API testing. CMS has said that there will be, this will come under existing auditing process for payers, and of course, there's going to be requirements as part of that. And as your vendor partner for this solution, we're here to take you all the way through, not just simply implement it and say, okay, it's done, but make sure you have the tools you need to meet all the auditing requirements from CMS. And similar for reporting, I think I mentioned some sample reports earlier, but you also have the tool integration with anything that you currently have within your organization that your IT team likes to use. This is CMS Interoperability as a Service is just one example of a way we can set up implementation. So think of it as a SaaS model in the cloud where you send us your data. I know that there's other vendors that are offering this option as sort of their primary. So we just want to call it out because it's a very common model where things are being uploaded to a cloud. Personally, I believe that that is a good way, but at the same time, there's many out there who don't want to send it down necessarily to a cloud service and wants to sort of keep the data within their walls. And so we're happy to support both. Implementation timeline considerations, there's a wide range, and we're talking to plans that have everything from just a few tens of thousands of members to millions. And so obviously this number is going to differ, but at the same time, the components are going to be the same and the process is going to be very similar. We got to figure out the deployment model. We got to do an assessment of your existing infrastructure, look at your data sources. The data mapping complexity could vary. Data quality could vary. Consent management, we need to adapt the technical solution to the policies that are in place. In some cases, the policies need to be developed. And then there's various third-party applications and client-specific requirements that we need to work through. But the reason I listed out here is to show you that we've thought through all of these. Our services team is partnering with our compliance and security teams to basically cover the whole spectrum of what is going to be needed. And then finally, for pricing, of course, there is no one number or one price. It's just going to be a variable. But what we are offering to do is to have a 1-hour session, meet with you, kind of talk through sort of our checklist of questions to really make some basic assessments and draw some lines around the scale of this deployment and sort of the readiness as well. And from there, we can quickly turn around some type of estimate based on what we find out from you. And we would charge a one-time implementation fee with a defined scope. And then license-wise or usage-wise, it could be a term or some type of annual subscription fee. And then, of course, depending on the hosting model, if you host, then there won't be hosting costs. If you have us host, we're very competitive in that area. We have an awesome managed hosting service. There will be a nominal cost for that. And then, of course, we're offering incentives for signups right now. We don't want to wait until next year. I think the advice that I'm giving everyone is that we really want to start this as soon as possible because once you go down that rabbit hole, and we're here to hold your hand through that, you'll be glad that you kind of have the additional time to really address things that do come up. And on the right-hand side, these are various high-level components. So we're not just selling you a solution. We're selling you the opportunity to just be our partner in this, and also our collective experience implementing a lot of the requirements and the testing that we've already done. We are providing, of course, the server and repository for Fire and the various Fire libraries. We have our adapters. We provide a data privacy and security framework for this, along with the various industry partnerships that we believe are going to be one of those accreditation bodies for doing things like third-party app registration and certification. And I cannot stress the last point enough. We really do think this is only the beginning. And this platform, it's not just these APIs, it's a platform for the future. And this will allow us to support you in future value-based scenarios and for future CMS requirements, for whether it's making data available, whether it's for coordinating care, whether it's for doing reporting. There's a lot of things that are going to be transformed over the next few years, and this is really the first step. And this platform is designed to support you in all of those that we anticipate. And with that, I want to kind of end our presentation, see if there's any questions, any comments, thoughts.
Thank you for that, Tony. And I will also tell the group that while we're giving you a couple minutes here, if you are a current ZeOmega client, please reach out to your account manager if you want to learn more about this. If you are not and you want to learn more or have a discussion for you, the email address is sales@zeomega.com. or you can contact us through our website, ZeOmega.com, as well. I don't see any questions. So at this time, Tony, Rahul, unless you have anything else, we will give these nice folks a couple of minutes back in their day.